In their early days together, you'd rarely find Doug and Emma apart. They were excited to take on life side by side, on land, by air, and at sea. But after several years of married life and mounting stress, things changed. They frequently disagreed and pushed each other to do things differently. Their family was slipping away, and they didn't know where to turn. Until they learned about a new type of couples therapy called Integrative Behavioral Couples Therapy, or IBCT, that saved their friend's marriage. Doug and Emma liked that it's based on years of research and focuses on the underlying causes of relationship problems. They agreed to try it out. During the first few sessions, their therapist Carla helped them better understand their relationship. Carla asked about their relationship history, how they interacted, what was going well, and what wasn't. Although they agreed on the excitement of their early days, they each had their own views of what went wrong. Doug said Emma worries too much, always wants to talk, and needs everything perfect. Emma said Doug spends too much time alone, leaves all the housework to her, and never wants to talk or hear about her day. Plus, they don't have much time together anymore. During the fourth meeting, the feedback session, Carla summarized Doug and Emma's relationship using the Deep Understanding Framework. This explains a relationship based on differences between partners, like that Doug is introverted and needs alone time, whereas Emma prefers to talk about things. Emotional sensitivities. Doug grew up in a strict household and withdraws when he perceives criticism. Emma grew up in a chaotic house of 7 siblings, often feeling unheard, so she likes things to be in order, and she's sensitive to being ignored. External stresses, like growing debt, demanding jobs, and parenting, and patterns of communication for overcoming stress and differences, such as Emma's approaching behavior and Doug's retreating behavior, which creates a vicious cycle. Wow, this made real sense to Emma and Doug. They never considered their relationship's core issues. Just understanding made them more hopeful. Carla told Doug and Emma she thought they'd be great candidates for the active treatment phase. She recommended they start with just 4 sessions. Doug and Emma liked this plan. They worked with Carla to identify specific treatment goals based on their deep analysis. Focusing on incidents in their lives, Carla helped Emma and Doug become more accepting of each other. Doug realized his distancing behavior made Emma feel unheard and unimportant, like when she was a child. And Emma started to understand Doug's sensitivity to criticism and tendency to withdraw to avoid becoming aggressive, like his father. As they became more emotionally understanding of each other's behaviors, they blamed each other less, felt more connected, and made concrete plans to change how they interact. Carla helped Doug and Emma learn new ways of communicating. They learned to, first, watch their approach withdraw patterns. Second, to plan a time and place for talking in advance. Third, rather than attack or assign blame, to focus on how the incident made each of them feel. And fourth, to use listening skills so each felt understood. Practicing these steps in session helped Doug and Emma start putting them into action. Emma and Doug also planned more quality time with each other and Sadie, including a couple too many visits to the ice cream shop. They also added positive activities they could do alone, so it wasn't all on the relationship. After a total of 10 sessions, Doug and Emma have turned the corner in their marriage. They now understand each other better, and they're relating better to each other, not to mention feeling more emotionally connected. They've committed to continue their gains by watching how they interact and working to understand each other's deeper feelings. Though many days still have their challenges, they feel more confident and in control than they have in years. Just ask Sadie and old Roxy. If you're dealing with relationship problems, there is effective help available. Learn more about proven treatments and how to find help at treatmentworksforvets.org.